Hey guys and gals, it's Dr. Mercy, and today I am coming to you talking about gallbladder dysfunction and how it is misunderstood, how we can learn to work with it instead of against it, and when you need emergency medical intervention versus when you can start doing something about it. Because there are a lot of signs and symptoms that occur well before it's a medical emergency that a lot of times get ignored. And if we start listening to the symptoms and we're even aware of what the symptoms are, we can do a lot of good beforehand. So I just want to talk to you about that today. First of all, in 90% of cases, and of course, I'm going to say this is not, if you are having issues, you need to seek out medical advice. If I am not your doctor, I cannot give you medical advice. This is what I know from doing research, shadowing a GI doc, from also seeing this occur in multiple patients across multiple years and being able to help them reduce chronic pain throughout their body, not just related to the gallbladder, all because we were able to help them reduce what was going wrong in the gallbladder by fixing other things that were happening around the gallbladder. So again, if your situation is dire, obviously emergency medical services are going to help you. If you're somebody who is starting to notice that something in your digestive tract is not going right, this advice may be helpful to you, but also follow up with your doctor. And remember that in your blood work, the blood work is the range of everybody who's getting an A through a D, the normal values. And if you're on the far end of either end of the range, you're probably pretty close to failing your blood work exam. We want you in a very tight, specific range to get an A or a B because we know that's where most people find the most health and the most vitality. So even if your blood work is quote unquote normal, that doesn't mean much to me until I see the numbers and can see how close to a you are and how close to a D you are. Because the closer to a D you are, the closer you are to failing. And failing is not an option, right? We want you as healthy as possible for as long as possible. So when we're talking about what can go wrong with the gallbladder, you can end up with gallstones. You can end up with a sludgy gallbladder, and you can end up with gallbladder attacks. But what do those look like? So I'm going to share my screen with you for a moment to show you all the areas where you might be experiencing pain if you're having issues with your gallbladder, because it's very, no, really, I would just like to share my screen. It's very interesting, the things that get overlooked as being related to the gallbladder, because everyone assumes it's two main points, but it actually turns out that it is a lot more. So if we look at this picture, these bright red hot spots, this is the right side of the rib cage and the upper back into the right shoulder, are typically what people notice as gallbladder symptoms, and they'll have a lot of pain right here underneath the rib cage, kind of in the diaphragm area, if they're having an acute gallbladder attack. And if all of the pain there is suddenly very intense, creating nausea, creating vomiting, creating a fever and chills, those symptoms, yes, immediately seek medical attention, because you may have been experiencing symptoms for a long time that you did not recognize as symptoms of a gallbladder issue that are now dire and require significant medical intervention. Other areas of pain, you can see these bright yellow spots on the front of the shoulders, almost as if you have bicep tendonitis, or you get that mid-neck headache where you're kind of doing this a lot, and pain on the back of the shoulder joints, pain on the bottom of the right shoulder blade, the elbows, wrists, the knees. I see a lot of knee pain and foot and ankle pain with gallbladder dysfunction, and then this big area of generalized pain in the back. And again, not everyone presents exactly the same, but if I see somebody who comes in to see me with low back pain and I cannot recreate their low back pain, I'm automatically thinking, what organ is creating this pain? And part of that is because in physical therapy school, we are taught differential diagnosis. And so when we look at the differential diagnosis for pain that I cannot recreate in the musculoskeletal system, we have to look at the organs. So then that typically leads me to palpate directly over the liver and into the gallbladder. And you can just kind of like reach in and touch it. And people will say, ah, yeah, that creates my pain. And you then know that there's a problem. And I do an organ exam on every single pain patient. Because if I can recreate their pain by palpating an organ, I know that I am not done with treating the musculoskeletal system by clearing out the musculoskeletal dysfunction that might be there, because most of us have some kind of musculoskeletal dysfunction after years of abuse and even sitting at our computers with not great posture, moving in not great postures, that kind of thing. So, an organ exam. Another thing that we want to consider when we are thinking about gallbladder dysfunction is the other symptoms that come with it. A lot of people will get chronic headaches. They'll get a little bit of indigestion because gallbladder issues actually coincide almost perfectly with low stomach acid. Low stomach acid means that you have trouble digesting food. That actually, and a lot of people don't know this, but this is a kind of chemistry lesson for you. A low pH, something that is very basic, can burn the skin more intensely than an acid. So when the stomach pH is too low and you're trying to digest food, it can actually create more of a burn and create more of like the gastric reflux, but it's not typically an acid burn, it's a basic burn. And so when we address what's happening with GERD, and this is a question I ask all of my pain patients, we have them do a stomach acid challenge test to see if the stomach acid is too high or too low. And it's a simple, very inexpensive test that you can do at home first thing in the morning. We'll often see very pale color stools that are either light brown or sometimes even all the way to white. They can have mucousy texture to them, but a lot of times what we see is kind of IBS symptoms as well, where they're just not, they don't digest food well. They get very gassy and bloated. They have trouble fitting it into clothes at the end of the day that fit them fine at the beginning of the day, because the more food they add to the system, the more likely they are to have a problem. They'll also have a dark, foul-smelling urine because they're not digesting food appropriately. So we really want to focus and pay attention to that. Dry eyes is another symptom of gallbladder dysfunction. Dry skin is a symptom of gallbladder dysfunction. Dry mouth is a symptom of gallbladder dysfunction. You can also have cracking and peeling of the nail beds, and the hair becomes dry and brittle, and dandruff on the scalp. Scalp is often a sign of gallbladder dysfunction because you're not absorbing fatty acids the way that you need to in order to replenish the lipid barrier that is in the skin. And a lot of times we'll also see these people have vitamin D deficiency because that lipid barrier in the skin is what helps your body convert the sun into vitamin D in the body naturally. So we really want to look at all of those things as what else can be happening when we can't find the trigger for this person's pain, movement disorder, indigestion, whatever it happens to be. Other symptoms, particularly for women, are going to be significant hormone imbalance. So those are going to be your women who have PMS, PMDD, heavy periods, periods that are not consistent. They might have a flow that lasts for longer than 5 days. And they have a lot of irritation with that, back pain, fatigue, etc. Sometimes we'll even see this as our patients who are anemic because they're not getting what they need. They can't absorb the nutrients out of their food appropriately. So there's a lot of symptoms that can go along with that. For men, we'll see it as they might have low T. Their testosterone may be fine, but they'll have hair loss because their body is not converting the testosterone appropriately the way it needs to, and they're producing a lot of DHT instead, and that causes hair loss. So there's a lot of symptoms of gallbladder dysfunction, and we really want to pay attention to what's happening. And again, this is not true for everyone. What we see most commonly with people who have gallbladder dysfunction is over time, they'll have increasing symptoms. And usually the answer is to take it out. It used to be that the markers for if this is gallbladder pain without doing a whole lot of testing was that if you were fertile, female, overweight, and around or under the age of 40. But we've started seeing this in 16, 17, 18, 19-year-old people, partly because of the standard American diet and how many low quality foods are in our nutrition program. So how do we change it? The number one thing that we can do is improve the health of the liver, because what actually happens with the gallbladder is that it's a storage duct and a sensory organ. It is a storage duct for bile. The bile is produced and cleaned by the liver and recycled by the liver. Its job is to emulsify fatty acids from your food and break them down so that your body can absorb what it needs to from those fatty acids and utilize them in the best way possible. It is supposed to help balance out your cholesterol numbers. We know that that doesn't always happen perfectly for every single person, and there are things that you can do to support yourself. The reason it's important to recognize the symptoms of gallbladder dysfunction is because the gallbladder is actually a sensory organ for digestion. The sensory part, it has a nerve that comes up to the esophagus. The esophagus gets triggered anytime you swallow, and it tells the gallbladder, this is a liquid, this is a solid. And the gallbladder then tells the stomach, the pancreas, the small intestine to prepare for different things, and also tells them when they need to release their specific different digestive enzymes. So when you start chewing in the mouth and all the salivary enzymes get mixed in with your food, and by the way, this is one of the most important things you can do for your digestion ever, is chew your food until it is the consistency of salsa. But also, if you're someone who gets a lot of your protein from protein shakes, in order to trigger the gallbladder to release the right things at the right time from other organs, please chew your protein shake. It makes a difference, especially if you're someone who experiences a lot of bloating with protein shakes. This can be a sign that your body doesn't know how to digest it because it doesn't recognize it. So it senses something in the esophagus, sends a message to the stomach that says, hey, start building up hydrochloric acid. We're going to need to break down this solid and break it down so that the carbohydrates get separated from the proteins and get separated from the fats so that we can all do our jobs independently of what you're doing. And we need you to really start working on that peristaltic movement of the stomach so that those gastric juices, the hydrochloric acid, can get mixed in appropriately. It has another nerve that goes to the bottom of the stomach, just as it enters the upper part of the small intestine, that says, hey, it's time to release the pancreatic enzymes. And then as it goes through another part of the small intestine, it's now time to release your gastric juices to start digesting simple carbohydrates, continue breaking down proteins, etc. I'm going to insert myself here with bile as well through the common bile duct that the pancreas also uses to secrete pancreatic enzymes. To digest the fats, emulsify them, use what we need, get rid of what we don't need. So if you lose the gallbladder, we almost always end up with a patient who ends up with low stomach acid, which means that they have trouble breaking down proteins. And they have trouble breaking down essential fatty acids. If they take out the gallbladder, there's also an increased risk for insulin resistance because, again, that food is not sensed appropriately. And so the right gastric juices are not released at the right time. And we end up with larger portions of carbohydrates in the digestive tract than should be there. And we end up breaking down the gut barrier and having large food particles leached into the blood system where they shouldn't be. And this can lead to autoimmune disorders. Typically, somebody who's also showing signs, if they're not paying attention to the body aches and pains, or they've been diagnosed with, if you looked at that chart, that's a fibromyalgia patient, right? It's all the spots that a fibromyalgia patient has, and they have to have multiple of those spots to get a diagnosis of fibromyalgia. But they also, if they are tracking, and I have people do this all the time, I want you to track your food, track how you feel an hour later. And it's not because I'm trying to create an eating disorder, it's because I'm trying to make them more aware of how specific foods make them feel. Energy-wise, gas and bloating, headache, feeling like your heart rate sped up, feeling like you're nauseous. All of those are symptoms that something's going wrong and we should be paying attention. So for people who get really like an upset stomach or like that gas and bloating about 2 hours after a meal, we're looking at low stomach acid and or gallbladder dysfunction. For somebody who has motion sickness and has had motion sickness their entire life, we're looking at, hey, is that gallbladder doing what it's supposed to do? For somebody who has a lot of light sensitivity, yes, we're looking at the adrenal glands, but we are also looking at, are the nerves getting the fatty acids that they need to be supported in order to support the ocular nerve so that it's not sensitive to light, because it needs light to then produce melatonin for sleep. So when we're looking at the gallbladder, we're looking at a host of symptoms across a very wide variety that you may not pull in as gallbladder symptoms until it's too late. A lot of people are going to ask about gallstones. Gallstones can form for a variety of different reasons. Sometimes it's a food allergy and you're creating a lot of inflammation. A lot of times it is because the body is overtoxic and the liver is having trouble appropriately cleaning the bile. So the bile should be this lovely like egg yolk consistency that is a light shade of green. And most of the time what we see is it is closer to like pancake batter or sourdough starter, and it's a very putrid, ugly shade of green. And I shouldn't say ugly. Some people probably like that color of green, but it's a shade of green that kind of triggers you to think, oh, that's probably not good. So we want to pay attention to the symptoms as early as they start. How can you test yourself for gallbladder dysfunction? You can eat a really high fat meal and see how you feel a couple hours later. If you have a lot of body pain, and you notice even an increase in pressure underneath the rib cage after a meal, try taking your hands. I'm just gonna stand up so you can see this for a minute. This is the bottom of my rib cage here. And you're gonna go on the right side. You can start from the middle and just start kind of pushing and lifting very gently. You're not pushing hard. And if you get to a point where there is a sharpness, it could be your gallbladder. And that would be when you might want to say, okay, I need a scan of my gallbladder and my liver. People who typically have gallbladder issues are people who are not metabolically stable. And metabolically stable to me does not mean that you're skinny. because I was a skinny person who was very metabolically unstable. Metabolic stability means that your body is functioning in perfect harmony and balance, and you are able to do a lot with very little and can function even on a low calorie day. So metabolically unstable. If you are somebody who gets hangry, so you feel like you need to eat every 2 hours, or you get just angry at the world, or someone has told you, do you need to eat something? Because your attitude adjustment has been not towards the positive. It's a sign that you have metabolic instability. It's actually when you have low blood sugar episodes, or if you've been diagnosed as hypoglycemic, it's a sign that you are metabolically unstable, that your body is responding inappropriately to insulin, and that you cannot maintain appropriate levels of blood sugar to keep your body functioning well and also your brain functioning well. So it sends a signal to change your attitude to make you eat. Oh, there we go. Sorry, something weird just happened. And then other things that make you metabolically unstable or indicate that you're metabolically unstable. If you're needing to eat or have coffee in order to have energy, that is a sign that you are metabolically unstable. Your body is using the caffeine as a way to produce artificial energy, as opposed to being able to produce energy through gluconeogenesis. And that is really a sign that you're struggling to be metabolically stable. People with anemia, this is usually an absorption issue. It can be a specific genetic dysfunction, but if you don't have that genetic dysfunction and you are anemic, it is most likely a metabolic dysfunction that needs to be solved. If you have an autoimmune disorder, we know that you are not metabolically stable, particularly if that autoimmune disorder is not genetic. And here's what I'll say, because this was something I found fascinating when I first started looking at this. My mom has an autoimmune disorder. Her mom has an autoimmune disorder. My brother has an autoimmune disorder. My sister has an autoimmune disorder. I had my genetics tested. I don't have the genetic markers for any of the autoimmune disorders that they have, but I was trending towards one of those autoimmune disorders. So your environment can very much play a role in the health of your body, and you can create an autoimmune disorder within yourself, which is a metabolic instability. There is no reason that your body should be attacking itself. People who are insulin resistant. So are people who have blood sugars that are too high when they're fasting, are people who have fasting insulin that is too high. Those people tend to have issues with their gallbladder. People who are never satisfied with a meal, regardless what's in it, and they snack a lot, typically are having an issue with the gallbladder. And they're snacking because sometimes the snacking for a short period of time relieves that like low grade nausea that they have that they don't understand. But also they're snacking because they're looking for something, and typically they choose a food that's deep fried or potato chips or something like that because they're looking for the fatty acids that they aren't otherwise absorbing because their gallbladder is not functioning as appropriate. There are other people who also have low functioning gallbladders because of medications that they've been on for different reasons. And I'm not saying that those medications weren't necessary. They absolutely may have been necessary at the time. There are people who have um, abused or overused alcohol, and they have difficulty with gallbladder function. And the first symptoms they usually notice are actually that they are paying attention to is actually heartburn. So when we're looking at all of those factors, we want to make sure that we're addressing the entire person and we're not just missing something as it doesn't fit the profile. If you have more questions about whether or not this is your body and what's happening with your body, start with that little pressure test. You can also eat a high-fat meal and see what happens. A lot of people with gallbladder dysfunction will also have foods with high acid foods, or have issues with high acid foods. They'll have issues with things like garlic, peppers, onions as well. And they will often complain that they wake up not feeling rested and they have very dry eyes when they wake up. So how do we help people who've had their gallbladder removed? Because it's important for digestion, right? So there are a couple of different supplements on the market. One of them is called TUDCA. I recommend TUDCA for a lot of people. I recommend digestive enzymes for people that have had their gallbladder removed. And I recommend digestive enzymes with every meal. Because if the gallbladder has been removed, the common bile duct may have been affected without you knowing it. And so you may not also be producing the right amount of pancreatic enzymes for you to digest food appropriately. And then I often will recommend bile salts as well, for people, especially say you're going to Mexican food and you want to have guacamole because it's a healthy fat and it's supposed to be good for you, but you know it gives you a problem. Taking the bile salts can be a way to help you emulsify the fats in that meal and absorb some more of them. I also recommend that for the most part, you maintain a low-fat diet, but that you are taking a very high-quality supplement with essential fatty acids in it because you do need them. You need them for brain health. You need them for nerve health. You need them for your eye health. And it's imperative that you get them somehow. But also, your body can only absorb what you're taking in as long as your gut is functioning well. For anybody that's had their gallbladder removed, we know that you're going to need to do a regular detox. For anybody that's having gallbladder symptoms, we know that you're going to need to do a regular detox. I start people with a liver and gallbladder flush on almost every single one of my programs because most of them need it. And I don't just say, here's the one I use, because there are things that can happen during this that require emergency medical attention. And I want people to know that they have someone to reach out to in that case, because a lot of people are afraid to go to the doctor these days. And I don't want them to be afraid to go to the doctor that they need to see to avoid a medical emergency. If you are someone who takes medication every day for whatever reason it is, you should quarterly do a regular liver detox. And you should be doing things to support your liver each and every day. There are also people whose genetics are going to predispose them towards liver and gallbladder dysfunction because their liver doesn't have the support it needs genetically to appropriately detoxify medications and hormones. And so doing a regular liver detox is going to help you. If you're interested in learning more about how you can get help with this and support with this, my links are in the description below, and I'm happy to work with you on this. And just remember that if you're having a symptom that seems odd and no one is paying attention to all the symptoms, you can test your organs simply by doing pressure over them or even tapping on them. And if it creates discomfort, especially your kind of discomfort, that's a great place to start.